Hey guys, welcome back to Anchored at Harbor Park. I'm your host Jason. I'm here with my guy Sonny of Bedogne Chiropractic.
Said it right.
Awesome. I was practicing that one. Today we're just going to talk a little bit about chiropractic, kind of what it was, because personally for me, before I was told that I needed to see a chiropractor, this was about 2.5 years ago, yeah. I had no idea what it was.
Right on.
So can you start, just tell the audience kind of what chiropractic is, what you guys are doing?
Yeah, for sure. That's a common theme when I get people that come in is, I've tried everything, now I'm going to try you, and it's like, all right, here we go. But it's totally normal and okay for that, because I feel they're there for a reason, and they've brought us, life brings you different paths, and they're there for that. So chiropractic, in a nutshell, is a proactive approach, not so much a reactive approach towards healthcare. Chiropractic in general, at its basic level and principle, is a corrective manner, not just quick fix. Now there is certain styles of chiropractic that run along and do quick fix care, and that's great for people, and that's a fit for some, but we're more interested in what we call corrective, which is long-term care.
Right.
Getting you functional, getting you at 100%, but then keeping you there. Because the reality is, I don't want to see someone multiple times a week for the rest of their life. I love my patients in our community, but that's not right. So we need to get them to a functional level, set their goals, what they're achieving and get to, and then maintain them at that. And that's the ticket, instead of just letting them go. And there's a lot in our profession that do that, and a lot that don't, and it's not right or wrong, it's just that's what we do differently. It's more corrective, more wellness-based, and even in the healthcare model, there's a dualistic form, which is my elbow hurts, look at the elbow. And then there's holistic, which is my elbow hurts, well, let's take a look at the elbow, but let's look at why the elbow is dysfunctional. Is it coming from the end chain? Is it coming from the top chain? Is it your neck? Is it the whole picture? So that's chiropractic, is a holistic approach. Dualism is more medical, which isn't right or wrong. It's just they're looking at that for crisis interventions. You had Doctors of PT on.
Yep, Christian last week.
Christian did a great job. They would be kind of a hybrid of the two, but they're dualistic, and they're going to take a great job and good care of that crisis intervention, getting you back. Talked about the phases of healing. They're the ones that are going to rehab you after a knee surgery.
Right.
I'm not your guy for that. Right?
Yeah.
I'm your guy once he's fixed you up, got you going well, keeping you maintained to that next level. So that's really chiropractic, and its core principle is that your body has this ability to heal, and it's called innate intelligence. It's run through your nervous system. So your nervous system is your brain running through your spine, and everything's controlled and coordinated off of there. And when there's disruption in that system, we call that a vertebral subluxation complex. You're not functioning at 100%.
We got a quiz on this stuff coming up soon.
There you go.
After this.
So I won't get too technical, but basically, if your body's sending information and targeting different areas of your body, say to your arm, to your leg, to your lung function, right, to your heart, to your digestion, it's all run off of this nervous system. And that runs through the spine. And when there's a joint that moves out of alignment, that's a subluxation. That's going to put pressure on that. So if your body's free-flowing at 100%, are you going to be healthy?
Yes.
Yes. Say you have multiple subluxations through your spine, and that nervous system is only talking to the rest of your body at 50%, what do you think is going to happen?
Things aren't going to do their proper function.
Exactly. And you're going to have symptomatology. So that's what we call dis-ease. And a state of dis-ease is when your body's not at ease and not in harmony. So what we do is we properly figure out where those are. We detect, we analyze first, right? Globally, posture, movement patterns, and then we go into a systematic analyzation, which we use a motion study specifically, which is a form of an x-ray. And then we detect those subluxations, okay? All right? And then we correct them. And then your body is free functioning and at ease, and it's at 100%, and you heal, and you get symptomatology go down. But you have to get to the cause.
Right.
You can't cover it up. Now, there's times when you need to have help, right? So, you fall off a cliff, you need morphine.
Right.
Right? But you need to get to the root cause to get full potential in health. That's what we do for people who get their full potential.
Cool. So that was a lot of information. It came fast and furious.
Yeah.
So I'm going to try my hand at kind of condensing this to maybe some layman terms.
Yeah.
So I get people who, I've been seeing you for about 2 years now.
Yep.
About twice a month.
Yep.
People come up and they ask, does chiropractic, does it work? Do you get benefit from it? And I say, I didn't have pain. I didn't go to you because my back hurt and I needed fixing.
Right.
I just went to you for general maintenance. Been going twice a year, and I haven't had any pain.
Right.
I've never been injured, I mean, except for my little knee thing, but I'm also training 2 hours a day, so that'll happen.
Yes.
But general, I've never had any like back issues, nothing. So
Right.
in the grand sense, like I look at it as it's doing its job. It's keeping me maintained. It's keeping me healthy.
That's a great point, and that's the hardest thing, not only in chiropractic but in our healthcare model, is that we're crisis intervention. We're all about more of a reactive society. Hey, my back hurts. I need to go take care of this now. More than being proactive and saying, hey, you know what? I'm functioning pretty well. I want to keep that, and then that's maintenance, right? You're maintaining your level of health, and then there's wellness. And wellness is, I want to keep that maintenance, but I want to go to that next level. So that's what chiropractic does when you're out of an acute stage and you get into more of a wellness phase. And that's what we're really good at, is keeping people, say clients of yours that want to hit a PR, right? Well, maybe they're at that point where they're just not, they're stuck in the mud, and you see that probably a lot. Well, their nervous system's probably not functioning at 100%, so they can't get to that PR level, right? So that's where we move in, we get them functioning more, and then they maintain that going forward. Or they want to go for their Italy trip, right? You know, like they've been saving up with their husband for years, and they just want to be at 100%. So they come to train, they come to get you there, and then they need that little extra boost, and we just maintain you going forward. So that's maintenance.
And then when you do get a little knick-knack everywhere, or anywhere, I should say, then your boy hooks you up.
You're coming in, and you know, like, you've been under maintenance every couple of weeks, you know, for a few years now, and if you do say, hey, you know, doc, I was doing this deep squat and I felt, you know, a little bit here, that could be an injury that if you've never been under care in the past, that might take longer. It might take multiple times for a few weeks or months even to get well, where since you've been under maintenance, your body's mechanics, the joint and muscle memory, already knows where it needs to be healthy, and we just got to set it, and it's actually going to hold that. One adjustment, that one treatment is going to hold longer for the next couple weeks rather than if you haven't done maintenance in the past. And that's another huge benefit of being proactive in your health.
Awesome. Well, thank you very much for sharing that. I think our viewers will get a ton of information from that.
Right on.
Anywhere you want to send the people to find out more about you or your practice?
So we've gotten into the social media game a little stronger. Myself, no, I just do the stuff, and then we have Dr. Callie, Dr. Corey with us, my wife, Dr. Anna, our team, Janie and Katie and Kyle. We're a solid team. We got KenoshaChiro.com is our website. We have a Facebook page, Bedogne Chiropractic, Bedogne, B-E-D-O-G-N-E. Said it right.
Fancy Italian name over here.
There we go. And then Bedogne Chiro on Instagram. You can hook us up there. We always extend. We've been taking care of your people for a long time. If they come in, we always we figure out insurance for everybody if they have it. Very important that they know that up front. It's not great, but it's like a coupon if it works great. If it doesn't make sense, we always take care of Harbor Park for $50 for that first initial visit, which would require an examination x-ray. We always extend that. So just, if you're watching the show and you see that, mention that and we'll hook that up for you.
Cool, awesome. And guys, make sure you're following us on Facebook, Instagram at Harbor Park CrossFit, and then subscribe to our YouTube channel as well. If you're not on our email list, make sure you put your email down, and then you'll get notified every time these videos come out. All right, thanks guys. Thank you, Doc.
Yeah, man.